Okay, this video is on scapular winging. I'm gonna have Kamal be the physical therapist, I'll be the patient, and let's just say I'm a patient coming in saying, the doctor said I have something called scapular winging and I have this pain around my shoulder blade. What's wrong? What do I do? Get me better.
All right, I'll try as best as I can to first, I would say, explain it as best as I can and kind of, I guess, give a small demonstration and some recommendations. And if I miss anything or if you want to add anything, you can just kind of add it. So, pretty much scapular winging, I'm going to have you stand up and face that way. So, as you can see, his scapula, so pretty much his shoulder blades here. So, you got the left one here, and then you got the right one here. You see how they're kind of flat, straight down. But with scapular winging, I want you to kind of, yeah. So just imagine that his scapula, left and right side, are kind of protruding. So they're kind of poking out, and they're further back than they should be. So this often comes from like muscle weakness in the posterior chain here. Sometimes it could be from some type of nerve damage, also some type of paralysis in general. So those are a few reasons why someone could have scapular winging. And treatment wise, we would do a lot of strengthening and mobility of the posterior chain. So you have a lot of your rhomboids here. We would also do some lat strengthening there and overall range of motion. So we would do some rotations to help out. Also, we could do some flexion extension, and that's kind of how I would start out the treatment. Anything you want to add?
How would you explain this if I was a real patient or if there were pre-PTs listening?
Got you. So pretty much, I would say your back should be flat like this here. But because of maybe years of overuse or some type of injury or a nerve injury that could be coming from possibly your neck area down into your scapular area, your back isn't, your shoulder blades aren't as flat as they should be. Now they're poking out to kind of compensate for whatever reason or any injury that you may have occurred in the past. So, because of those things, we're going to do strengthening, range of motion to try to get the scapula back into the original position or at least closer to where they originally should be. Is that better?
So a patient might say something like, so my shoulder blade's hurting and my scapula looks weird because the muscles aren't working right, and we're gonna fix it by